an effort to establish a national healthcare facility regulatory agency and ensure comprehensive and meaningful healthcare services delivery to all Nigerians, the Federal Ministry of Health and Social Welfare has inaugurated a technical team on national medical laboratory regulatory and inspection against quackery.
What we're set out to do today, inaugurating this technical committee on laboratory regulation and inspection, with the sole aim of eliminating, not fighting quackery alone, but eliminating quackery in our entire health sector.
The Honourable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, while inaugurating the committee, reiterated the need for strict regulations to protect citizens from illegal healthcare activities, such as the recent revelation about illegal kidney harvesting rings operating in Abuja. He emphasized the government's efforts to achieve President Bola Ahmed Tinubu's renewed hope agenda, particularly in the health sector. Dr. Alausa, who highlighted the ministry's 4 pillars to achieve these goals, amongst which is improve governance in the health sector, improve health population outcomes, unlock healthcare value chain, and health security for Nigerians, urged them to ensure accurate databases of laboratories and functional inspection protocols.
Accredited must be put on your website, and your legal you put your director of legal on this part of the thing. They should also be prosecuted. If you find them functioning, we have to take them to court. You have to get the police. We have a one government now. This government is functioning together. There's no division anywhere, and we're collaborating very well. If you want to go do your inspection, you want the police to follow you, just write to the Inspector General of Police. It would quickly provide the men and women in uniform that you need to go. We have to enforce, and we have to show that this is a government. We listen, but we care. And part of the way government cares for the people is to enforce all the laws of the land. And that's what we're doing, and we're doing it everywhere. And that's why we said our first pillar is governance. And you can see, even without spending a lot of money yet, just improving governance in the health sector, a lot of things have changed. Lots of things have changed. We're holding ourselves more accountable. Now, we're using this Medical Laboratory Science Council as a model to regulating our healthcare in the country. It's sad, but I'm not ashamed to say it. We're not regulating. We don't have a process to regulate our healthcare facilities in the country. Honestly, our hospitals are not being regulated. Diagnosis centers are not being regulated. Surgical centers are not being regulated. And we all seems that, we have this idea to regulate. But you look at the Medical and Dental Council, they only regulate the health professionals. We have the Nursing Council. They regulate the nursing professionals. The same thing with the Pharmaceutical Council. But our facilities are not regulated. They're not. And you won't know until I got to know this, and I'll give you the way where I got to know this. Our kids were being abused. Some bad element in the country, they were going to harvest these kids' kidneys, paying them pittance, selling, deceiving them, harvesting their kidney and selling it. There was a cartel that built up around Abuja and some other parts of the country. A very smart journalist did a big expo. So I called her, we talked and said, okay, what do we do? I called everybody, the IG, the Medical and Dental Council. Today, as I talk to you today, the hospital that was exposed in that act, nothing is being done to the hospital. The hospital is still open today. We don't have any mechanism in the country to shut down that hospital today. We do not. We do not have, as I'm telling you, we do not have any mechanism by law to shut down that hospital. We have mechanism to punish the doctors which we've done, but the facility, we do not have any mechanism to punish that facility. That's the fact of the matter today. But then we're moving quickly to setting up a national air facility regulatory agency that we're going to move. We'll take to the to FEC, and then President will give us right to go executive bill to the legislature. At least we know where this huge gap is, and we're working to fill that. But the good thing, the beautiful thing of all this thing I've talked of all this gap that I've identified, in the on the lab side, we have part of the heart of the Medical Laboratory Science Council of Nigeria to regulate facilities. We will now use that, at least we will start, and that's why we have to do this very well. We have to get it right to regulate, to start regulating. And this will be a model for a bigger regulation of the other facility in the healthcare sector. And that regulation, and I can promise you today, that the regulation of the lab will stay within the domain of the Medical Laboratory Council. So you need to do that very well. You need to show the country that you can do that. You need to show our people that you care, you can help regulate so that the lab services in the country, so that our citizens will be assured that whenever they go to any labs, whenever any result is given about their health in any hospital, those results can be trusted, they are validated results, and they can trust, and care decision, medical care, healthcare decision can be made that will be sound on those results. You hold a pivotal role here, and please, don't let the nation down.
The chairman of the technical team, Professor Tosin Irabo, in his response, outlined the team's goals, which includes developing a sustainable model for national laboratory inspections, improving quality management systems, and combating quackery and unprofessional practices in laboratories.
We listened carefully. Me and my team are very sure. The points we were giving out to us, if this is not done, it should be shot. I want to assure you, sir, with the mandate today, renewed mandate that has been given unto us as these technical members, we will not fail the nation. In the next 6 months, the story of laboratory practice in this country will change. Anytime we run into difficulties, please, we shall come back to seek your guidance. Thank you so much, sir.
Comfort Olayinka, Eco Hot TV.